So yes, well, our opening session is going to be hybrid. We are going to have two speakers, Marita Hefler and also our colleague Coral Gartner, who is here in person. I don't know whether the online streaming is working. Yes, it's working. So I'm going to do the presentation of both of them. So, dear fellows, I'm pleased to open the symposium with this opening talk with two distinguished experts who have made remarkable contributions to global tobacco control. They are Marita Hefler, who is online, and Professor Coral Gartner, who is here with us today, and both serve as editors of our flagship journal, Tobacco Control. I'm going to introduce them, okay? Very briefly, because they have a very long curriculum. Dr. Marita Hefler is an associate professor at the Menzies School of Health Research. Her work spans areas such as social media, phasing out commercial cigarette sales, monitoring tobacco industry activities, and promoting smoke-free policies in prisons. She brings particular expertise in qualitative research and public health program evaluation. She is online. Hi, Marita, are you there?
I am. Can you hear me?
Yeah, we can hear you. We cannot see you, but we can hear you. Okay, probably later we are going to see you. Okay, so I'm going to introduce our second speaker, who is Professor Coral Gartner. She is with us today. Thank you, Coral, for being here. She is also from Australia. I have not mentioned that Dr. Hefler is from Australia. She's there. So we really appreciate that she's at this time of the day awake for doing the talk. But we have the lucky also to have Coral Gartner here, who is also from Australia. She's the director of the Center for Research Excellence on Achieving the Tobacco, Endgame, and she's a leader in tobacco control policy and electronic nicotine delivery systems. Her research contributions extend across interdisciplinary approaches to ending the tobacco epidemic, from evaluating international tobacco control policies to exploring innovative strategies for achieving the tobacco endgame. Together, they are going to give the talk, and they will share their insights on the pivotal role of research in driving global tobacco control efforts. Please join me in warmly welcoming them to our symposium.
Okay, so thanks so much for the invitation to join you today. I know both Marita and I are very honoured to be here presenting amongst so many international colleagues and friends too, both in the room and online. So this is a hybrid presentation with Professor Hefler in Darwin, Australia, and we're hoping that the technology is going to work for us. So Marita's going to be changing the slides as we go. Okay, so first I'd like to acknowledge that I come from the lands of the Gimoy Wallabara Yidi peoples, that's unceded lands, and I now live and work in Meanjin, which is also known as Brisbane in Australia, and that's the land of the Turrbal and Yagara peoples. So I like to pay my respects to their ancestors and descendants who continue cultural and spiritual connection to that country. For those who don't know me, my disciplinary background is environmental health and epidemiology, and I've been in the tobacco control field for quite a while now. My first introduction was as an enforcement person in the regulatory space when the first tobacco control laws came into my state in Queensland, Australia. So I've had that experience of being a frontline worker as well in tobacco control. And I've been in the tobacco control policy research space since I finished my PhD in 2006. So now I've had the real pleasure of leading a research centre on tobacco endgame policies, and that's been the last 4 years, and that's funded by the National Health and Medical Research Council in Australia. Yeah, and I guess what I'm hoping to achieve today is also to emphasise the multidisciplinary nature of the work that we do. And we have a really large team, not only in Brisbane, but also throughout Australia and also internationally. So that's my background. I've also had the pleasure of being on the editorial board for tobacco control since 2012 was when I joined as a senior editor, and then also the Australasian editor since 2018. And actually next year I'll be taking over the chair of the editorial advisory board, so I'm really honoured to be taking that position from next year. So I'll now hand over to Marita to introduce herself.
Thanks so much, Coral. Can I just check that our first slide is showing?
Yes.
Of course, go.
Great. Okay. I just wanted to add my thanks also to ICO for hosting us today. I'm really sorry I can't be there in person. I was actually there 2 years ago and it was a fantastic program. So I'm really sad to not be there in person amongst so many friends and colleagues. I also acknowledge that in Australia, First Nations peoples have never ceded sovereignty over their land, which was stolen as part of British colonisation. And today I'm presenting from the lands of the Larrakia people, which is also known as Darwin. I acknowledge their ongoing custodianship and connection to the lands and waterways and pay my respects to elders past and present. A little bit about me for those who don't know me. I started working on tobacco control initiatives about 20 years ago in service delivery and training roles. And I joined Tobacco Control as the news editor in 2012, became a senior editor at the journal in 2021, and then was appointed as editor-in-chief in January of this year. Obviously, I love punishment. In my own research, I've worked on a range of different topics, and I'm affiliated with the Centre of Research Excellence in Achieving the Tobacco Endgame that Coral is a director of. I currently lead a large project working with communities in remote areas of Australia to co-design strategies to reduce availability of commercial tobacco, and I'm involved in various projects to generate evidence for the tobacco endgame. As you can see, we both have a strong interest in the tobacco endgame, so our presentation will feature that quite heavily, but we will talk about tobacco control research more generally. Just before we proceed, a quick note about competing interests, because we forgot to put a slide up about that. Both Coral and I do not accept and have never accepted or sought funding from the tobacco industry or related industries such as the e-cigarette industry, nor from front groups or others funded by them, such as the Foundation for Smoke-Free World or Global Action to End Smoking, as it's now known. Neither of our universities and the Tobacco Control Journal and the CRE all of them have policies against accepting tobacco industry funding, and neither of us have ever received funding from the pharmaceutical industry. I'll hand back to Coral to just give an overview of the presentation.
Okay, so this is just a brief rundown on what we're going to cover in this talk. So we're going to discuss key trends and gaps in tobacco control research as we see it, and also discuss what makes research publication of a research publication of high value, particularly to the evidence base and to policy making, and also how we match research to the right outlet, the right journal. And we're going to present 2 case studies. So Marita's going to present on tobacco plain packaging, and I'll present a case study on the commercial tobacco endgame research program that I'm leading. So Marita will cover the first half of the talk and provide some of these examples, and then hand over to me for that final example. So back to you, Marita.
Thanks. I wanted to just give a bit of an overview, looking very non-systematically at submissions to tobacco control in the last 2 years or so. We have our sort of constants that have been submitted to the journal on an ongoing basis over the years around things like trajectories of product use, social marketing, and tobacco industry activities. But we're increasingly seeing publications around endgame strategies. These include tobacco-free generation, smoke-free generation, and we're expecting to see more on the nicotine-free generation, which is emerging as an approach in the US state of Massachusetts that's really pioneering implementation of this type of policy. We also see some publications around very low nicotine cigarettes, in other words, reducing nicotine to non-addictive levels, changes to retailing, incentivising retailers to stop selling cigarettes, banning or restricting where tobacco products can be sold. With increasing interest and momentum in the endgame, we're seeing a lot more research around stakeholder views of endgame strategies, and of course the role of non-combustible tobacco products and what that might be in the endgame, as well as industry responses to the endgame. We're seeing increasingly sophisticated modelling studies which project how different policies will change prevalence in the near and short term, as well as predicting economic impacts. And of course, as has already been noted and mentioned by previous speakers, there's a lot around new nicotine products, which includes the health impacts, including multi-product use, the use of descriptors in marketing, and particularly the emerging issue of non-tobacco descriptors, marketing practices, including novel avenues for supply, particularly social media, what potential regulatory frameworks might look like, analysis of the normative influence of key health agencies such as the US Food and Drug Administration, and the role of new nicotine products in promoting uptake of smoking, reducing smoking, and achieving the end game. In terms of the gaps which I've listed here, synthetic nicotine and nicotine analogues seem to be very quickly emerging. Equipping retailers for the end game is another area of focus, and the economics of the end game, and we're particularly needing to see more about reducing government dependence on tax revenue. So in terms of thinking about what is a useful contribution, obviously keeping epidemiological evidence current is really important, and sometimes these studies are somewhat marginal in terms of knowledge contribution, but they help us to constantly refine our understanding of the magnitude and nature of health harms. Of course, we need a focus on cessation treatment as well. It's important to ensure people who smoke are offered the best and most effective treatments, and that those treatments are accessible. Surveillance of tobacco use prevalence and smoking pathways, which helps us to determine where efforts and resources should be directed. Of course, tobacco industry monitoring is important, which includes lobbying and advocacy by the industry, marketing strategies of different products, and how the tobacco industry works with front groups and others to advance its interests and distort science. And of course, we need to see advances in policy, and I'll talk a little bit more about this in some of the coming slides, but around monitoring loopholes, new approaches to policy and impact evaluation are all important. As I'm the Editor-in-Chief of Tobacco Control, I can't really go through this presentation without also talking about what our priorities are. Now, thinking back to the previous slide, epidemiological studies are typically of interest to tobacco control only if they're significantly breaking new ground. For example, large studies from previously understudied countries or regions, significant changes in our understanding of the magnitude of product harms, and the use and impact of new products. So really important that it's about significant advances in our understanding rather than that marginal change that I talked about in the previous slide. A study confirming or refining knowledge about, for example, cancer or cardiovascular risks of smoking would be better suited to an epidemiology-focused journal than tobacco control. Similarly, cessation studies are typically not of high interest to tobacco control, as our focus is not on clinical treatments, although we may be more interested in studies that examine accessibility of services. Tobacco control has a normative and policy focus. We're not simply about publishing the science, but about evidence that can inform policy. And similarly, our global audience determines what we will publish. So our priorities look a little bit different to local journals. We do publish small-scale studies, but there needs to be wider applicability. So, for example, a study about the attitudes and knowledge of a small population group, the knowledge and attitudes they have about smoking would likely be rejected, whereas a case study of tobacco industry interference in a policy initiative would be of interest and offers lessons for other jurisdictions. We would be unlikely to publish a national study of prevalence or attitudes towards cigarette smoking, but we might publish some of the first national studies of the prevalence and attitudes towards a new product. We're interested in papers that push tobacco control policies in new directions or provide new angles to existing policies. And the journal has been closely associated with the Framework Convention on Tobacco Control throughout its history. We're always interested in papers that can take FCT measures in new directions. Similarly, we are always interested in documenting the activities of the tobacco industry, whether that's marketing tactics, lobbying strategies, collaboration with other groups, co-opting public health narratives, or examination of historical activities, which can help inform our understanding of contemporary strategies. Reviews and evidence syntheses are always welcome, and Coral will talk a little bit more about that. Finally, methodological rigour is essential, particularly for research papers and reviews. The methodology should match the research question and study design. We do publish all types of methodologies, and we aim to have reviewers who are specialists in those types of study designs. Author teams need to include experts in those methodologies. So, for example, we wouldn't expect to see a qualitative paper state that it did statistical analysis. And it's worth noting that we have a range of paper types. So if your study is not a full research paper, look at those other options. For example, Industry Watch, Ad Watch, and Advocacy in Action. I'm now going to talk a little bit about the case of plain packaging. We know that introduction of any new tobacco control policy takes a combination of advocacy and evidence, as well as policymaker champions, and usually some luck. The case of plain packaging provides a good demonstration of the evolving contribution of research. I've put together a brief timeline here of the introduction of plain packaging. As most of you will know, Australia was the first country to introduce this measure in 2012, although it was an idea that had been around since the 1980s, and Canada attempted to introduce it in the mid-1990s. This is a similar pattern to graphic health warnings, which were first implemented by Iceland in 1985, but repealed. And today, many people think of Canada as being the first country to have implemented graphic health warnings in 2001. Research about initiatives that did not get implemented, as well as those that did, is extremely important for moving the tobacco control field forward. There are few truly new ideas. In Australia, plain packaging was first put forward as a possible policy measure in October 2008 when a preventative health task force was established by the Australian government and recommended it in a draft report. That report was released for consultation, and then in November 2008, the Framework Convention on Tobacco Control Guidelines for Advertising and Packaging recommended plain packaging. In September 2009, the then Australian Health Minister released the final report of the Preventative Health Task Force recommending plain packs, and in April 2010, the intention to legislate the policy was announced. In 2011, there was a protracted legislative process, we started to see challenges taking shape from the tobacco industry and some governments. In December 2011, the policy became law and it was fully implemented by December 2012. For the next several years, there were a series of legal challenges, all of which were unsuccessful, and from 2017, other countries rapidly started to implement the policy. So what did we need in terms of research evidence, and how has that changed? Before implementation, what we needed was experimental evidence of its likely effectiveness with people who smoke, and evidence to counter the tobacco industry's scare tactics and likely legal challenges. The government needed to see that there was public support for these measures, and also lessons learned from previous attempts to introduce the policy elsewhere, noting the Canadian attempt to introduce it in 1994, which was blown out of the water by the tobacco industry and its scare tactics. After implementation, it was important to have evidence of its impact on smoking uptake and prevalence, as well as public support after implementation. And of course, we know that public support typically increases for any tobacco control measure after it's implemented. We also needed understanding of how it withstood legal challenges and policy factors that helped it succeed or were barriers to implementation. What do we need now? Given that many countries have implemented plain packaging, there is still a need for country-specific evaluations of impact. Often these will not generate new insights, but what they do is add to the weight of evidence. And such evaluations may also help lay the groundwork for other tobacco control policies in the country where they were done. These types of studies are more likely to be of interest to journals with a national focus. At this stage, tobacco control would be unlikely to publish an evaluation of plain packaging legislation unless the findings were significantly different from the experience of other countries. We also need to understand how the industry responds in different places. How it responds now, does it look different from the first case? This includes the marketing strategies that they use and exploitation of policy loopholes, the lobbying and the legal challenges. And we also need to understand how the policy can be expanded and adjusted. For example, Canada standardised stick sizes, and that's something that would be of interest to tobacco control. Also of interest are reviews and evidence syntheses of the cumulative impact of plain packaging across different countries. We know that the impact in isolation of plain packaging is relatively marginal, but as with many policies, when it's put together with a whole suite of policies, we gain a better picture of the overall number of preventable deaths averted. And I've just put here some examples of research that fit the timeline shown on the previous slide. The first paper on the left is a historical count of Canada's attempt and the political interference that derailed it, authored by the fantastic Cynthia Callard and Physicians for a Smoke-Free Canada. Moving across the top, we see a research paper that reported on experimental research of likely impacts of plain packs, which was published in September 2008, just as the policy was starting to be recommended in Australia. The next, on the right-hand side, is a review by the University of Stirling of the evidence that existed to date at that time. And the two studies at the bottom the middle study shows the changes in support for the policy among people who smoke, showing an increase from 28% prior to implementation to 49% after implementation. And the two studies at the bottom of the slide collate evidence and lessons learned, along with recommendations for how the policy can be improved as it is adopted by more countries. I'll hand back now to Coral to talk about the case study of tobacco endgame research.
Okay, thank you. So when we were setting up the Tobacco Endgame Centre of Research Excellence, we started by considering what frameworks there were for generating and also translating research evidence into policy and practice. And we selected the Knowledge to Action framework as giving us a framework to work towards for our program of research. So you can see here, this is part of that Knowledge to Action framework is the knowledge creation funnel. And you can see that you start with knowledge inquiry, original research studies, but also syntheses are very important here, and they're often of more value to policy making, where you actually get the whole breadth of the research and bring it together. So we started off with looking first across all the evidence syntheses that were available for tobacco endgame research, and we published this review of evidence syntheses in the journal Tobacco Control. So from there, we were able to identify where the gaps were and where we should focus our efforts and generate further evidence syntheses, but also planning our original research program. Thanks, Marita. Next slide. So in addition to that review that was on the previous slide, these are some other examples of evidence syntheses that we've conducted. So you can see that there's one that's looking at priority populations. So that's really important because populations with high smoking prevalence, they're the ones that are going to be most impacted by tobacco control, tobacco endgame policies, but also those that will benefit the most, right? So understanding what research had been done for those specific populations is very important. The next study up there on public support was conducted by colleagues, led by colleagues in South Korea. And so that sort of brought together the global evidence on how the public think about and support these types of policies. And also we did some policy-specific reviews. So this one here was on the policy of restricting supply of tobacco products to pharmacies, a bit of a controversial policy, but one that has been discussed and looked at in different countries like Iceland and so on. Okay, thanks, Marita. Next slide. So in the next few slides, I've tried to kind of outline the types of research areas that may be particularly valuable for new policies, such as tobacco endgame approaches, but also recognising that these are quite challenging where they haven't been implemented anywhere before. So thinking through about what type of evidence we can use and what evidence we can generate. So first, obviously projecting the likely health impacts of a policy is going to be very important to policymakers because ultimately that's the whole point, is to let them know what we think is going to be the benefit of implementing a policy. And, the first step of that is obviously working out what we think the impact on smoking prevalence will be. And so from there, you're looking for that evidence from if a policy has been implemented somewhere else. Obviously, that's the first step. But sometimes it's a new policy. It hasn't been implemented anywhere. So we have to draw on other evidence. So things like consumer surveys, where we ask people about what they think they will do if a policy was implemented, that kind of anticipated response. But also we use expert knowledge elicitation, where we get a panel of experts who've got experience in different policy implementation and get their best guesses on what they think is going to happen. So it's drawing together all that evidence and putting that into a model is where we can make that more real for policymakers in terms of thinking through how the policy might work and what the outcomes will be. Sometimes it's important to also look at specific populations in addition to the overall population too. So we often do that with epidemiological modelling, where we build that model with all those different inputs. So the evidence for each of those different factors is obviously important on its own, but when you bring it together in a model, I feel like that's where it really comes to life in terms of if you're going to implement this. It's also important to think about the economic costs and benefits. That's really important for policy making, obviously. And as a health researcher, we're often thinking about the healthcare costs, but governments also have a wider remit. So thinking more broadly about the economic costs on business, but also on government revenue can also be important. And you can, generate all of these estimates within a model. One of the things that we did with the Smoke-Free Aotearoa Smoke-Free Action Plan was to try and estimate the impact on households. And I think that's also quite an important step to do, to show the benefits for individuals and households from not spending money on tobacco and how that helps the household budgets. And also thinking through about the impact on government budgets. Okay, thanks, Marita. Next slide. So these are a couple of the examples that of the modelling studies we did. So the first one was estimating the impacts of the Smoke-Free Aotearoa Action Plan group of policies. So that was tobacco-free generation, reducing the number of retailers that could sell tobacco, and also